I consider this patient example a quintessential demonstration of the value and superiority of symptoms, showcasing their effectiveness beyond the clinical experiences of numerous specialists across various hospitals in South India. It highlights the consequences of overlooking the importance of a particular symptom, neglecting nature's intended method of healing, and the unmatched value of a single symptom over countless advanced laboratory investigations. The example also illustrates the confidence of the homeopathic physician before initiation of treatment, who reassured the patient by referencing a symptom listed in the Materia Medica book. Conscious but confused when attempting to move, the muscles refuse to obey the will, which corresponds to the effects of the medicine derived from the plant Gelsemium sempervirens. This confidence, rooted in a single symptom, was never afforded to him by various specialists despite numerous invasive, traumatizing laboratory investigations that led to a myriad of diagnoses, none of which aligned with one another across prestigious hospitals in South India. This is the medical history of a patient dating back to 1978, approximately 46 years ago. Although I did not treat him, I witnessed his suffering since my adolescence as he was my neighbor. Here is the sequence of events. In 1978, at the age of 22, he collapsed while playing kabaddi. He was unable to stand due to a lack of energy in his thighs, his arms were paralyzed, and he was unable to lift his hands even to wipe his tears. Despite this, he remained conscious and his mind was active. He experienced retention of urine and was admitted to Osmania General Hospital in Hyderabad, the largest hospital in the area. He was treated with steroids and recovered completely within 3 to 4 days, though no definitive diagnosis was made. In 1981, at the age of 25, he awoke one morning unable to get out of bed or go to the bathroom due to paralysis in all 4 limbs. He was catheterized for an inability to pass urine and was then transferred to Osmania General Hospital. Investigations revealed the only abnormality as a serum potassium level of 3.3 millimoles/L, with normal cerebrospinal fluid, CSF. He was again treated with steroids and fully recovered within 3 to 4 days. The possible diagnoses included familial periodic paralysis, Guillain-Barré syndrome, and recurrent relapsing polyneuropathy. In 1983, during the 3rd episode, the patient experienced total paralysis of the limbs and was admitted to Christian Medical College and Hospital in Vellore, the largest and most advanced hospital in South India at that time. The patient presented with symptoms including urine retention, the ability to pass stool, aching pains in the limbs, and a distended bladder. Neurological examination revealed a motor system power of grade 3 to 4, decreased tone in all limbs, sluggish deep tendon reflexes. During the patient's hospitalization, extensive diagnostic investigations were conducted with the following results. The electrocardiogram, ECG, showed a shortened PR interval. The cerebrospinal fluid, CSF, analysis was normal, as were tests for creatine phosphokinase, CPK, lactate dehydrogenase, LDH, porphyrins, and electrolytes. Electromyography, EMG, revealed no evidence of reactive denervation or myopathic changes, and the muscle biopsy identified a few large clusters of lymphocytes. The ammonium chloride loading test yielded equivocal results, and the hypokalemic provocation test did not induce muscle paralysis. Further EMG and nerve conduction studies, as well as a bone marrow biopsy, provided no additional insights. The diagnosis made was myasthenia gravis. The discharge advice included the following recommendations. 1. The patient should come to the emergency department, referred to here as causality, as soon as he develops symptoms. 2. Plan for further testing, including a tinsulin test, serum electrolytes, urine analysis for myoglobin, muscle biopsy, and assessment of tubular functions immediately upon symptom development. In 1984, he was admitted to the first corporate hospital in India at that time in Chennai with symptoms of pain in thighs and arms whenever he exerts himself. After being investigated, nothing abnormal was found, and he was treated with potassium chloride syrup, 2 teaspoons 3 times a day. The diagnosis was hypokalemic periodic paralysis. Exhausted from repeated hospital admissions and extensive investigations, he sought the expertise of an experienced homeopathic physician. The physician recommended reading about the symptoms of Gelsemium from the Materia Medica and assured him of recovery. He proceeded to take a weekly dose of Gelsemium 1000 ch for 6 months, and experienced no recurrences for 16 years. In 2000, despite facing similar issues, but without any urinary problems, he took Gelsemium 1000 Sich for 3 days and encountered no further issues up to the present day in 2024. His profound appreciation for Gelsemium 1M inspired him to learn basic homeopathy himself. This case highlights the remarkable effectiveness of symptom-focused treatment, providing benefits that surpass those offered by prestigious hospitals with their extensive diagnostic procedures. Conscious, but the muscles refuse to obey the will, a characteristic symptom of Gelsemium that led to his recovery. This illustrates how recognizing the significance of a single symptom can outweigh multiple consultations and investigations across various specialties in different hospitals. He is around 68 years of age now, staying in the USA, can walk 15,000-20,000 steps in a day, and always carries Gelsemium 1M with him. I will discuss how diagnostic errors can arise when medical investigations are emphasized over patient symptoms, featuring examples in my next video presentation. Consider the scope of knowledge a cardiologist has about chest pain causes. Despite the common rush to these specialists, they are trained to recognize only approximately 14% of these causes. In comparison, a pulmonologist might identify about 6%, a gastroenterologist around 5%, and a musculoskeletal specialist barely 2%. But what about holistic practitioners, like homeopaths? They can discern between 75% and 90% of chest pain causes. Not only do they identify these issues, but they also treat them with straightforward remedies. Stay tuned to the Try Incurable channel to hear the compelling stories of 2 women, one a doctor, who endured open-heart bypass surgeries that failed to alleviate their chest pain. This was not due to deliberate oversight by specialists, but because their training does not equip them to interpret symptoms in the holistic manner intended by nature. Focusing exclusively on heart attacks for chest pain, which account for less than 5% of all cases, can overlook the predominant causes related to constitution, which represent 95% of other causes. This oversight often leads to unnecessary procedures, interventions, and anxiety. Impressively, up to 75% of chest pain cases could be effectively managed by addressing constitutional factors alone. Only those cases unresponsive to this approach require further investigation.
I have only one life and one heart, and I firmly believe that the doctor managing my heart should be well-versed in constitutional medicine to rule out all treatable causes of chest pain related to the constitution. Unfortunately, knowing that modern-day specialists, while skilled in interventions and procedures, lack training in this crucial area, how can I entrust them with the care of my only heart, given that I have just one life?
I am Dr. Sudhakar Reddy Tirupthi, specializing as a pediatrician and holistic practitioner with a focus on spiritual medicine named homeopathy. I extend a warm invitation for you to explore and subscribe to my channel, Try Incurable. Here, you'll uncover a treasure trove of unique and insightful health-related content that transcends traditional approaches. My channel is a source of invaluable information with the potential to significantly impact your life positively. Should you be inclined towards a holistic view of health, I urge you to subscribe to Try Incurable and share this resource with your network. I deeply value your time and interest in my approach to holistic health, and I sincerely thank you for it.